Are there other options for cryptogenic stroke prevention after PFO? When it comes to preventing another stroke in someone with a cryptogenic stroke and a patent foramen ovale, or PFO, there are more choices than just closing the hole. While closing the PFO with a catheter is one option, medical therapies like antiplatelet medications and anticoagulants are also important tools. These options are tailored based on each person's unique risk factors and medical history. PFO closure involves inserting a small device through a catheter to seal the opening in the heart. This can prevent paradoxical embolism, where a clot from the veins bypasses the lungs and enters the brain, causing a stroke. Recent studies have shown that in carefully selected patients, especially those under 60 with high-risk PFO features, closing the PFO along with taking antiplatelet drugs can significantly lower the chance of another stroke. But, like any procedure, it has risks, including the possibility of developing irregular heart rhythms like atrial fibrillation. Because of this, the decision to close a PFO should involve a team of specialists and the patient, weighing the benefits and risks carefully. Medical therapy options include antiplatelet drugs such as aspirin, which help prevent blood clots from forming. These are often the first choice for stroke prevention, especially if the risk of bleeding is higher or if the patient prefers less invasive options. Anticoagulants like warfarin or newer direct oral anticoagulants work by reducing clot formation even more effectively in some cases. They are especially useful if there are other reasons to use them, such as atrial fibrillation or blood clots in the veins. The choice between antiplatelet and anticoagulant therapy depends on the individual's overall health, bleeding risk, and ability to follow treatment plans. In some cases, if a person has a PFO but has never had a stroke or blood clots, doctors usually do not recommend closing the PFO or starting medication. This is because a PFO by itself often does not increase stroke risk. Preventive treatment before any stroke occurs is not supported by current evidence. Deciding the best approach involves shared decision-making. Doctors will review all the facts, discuss the potential benefits and risks, and consider the patient's preferences. A thorough stroke workup is essential to rule out other causes of stroke before focusing on the PFO as the culprit. In summary, besides PFO closure, options like antiplatelet therapy and anticoagulation are available to help prevent recurrent strokes in patients with cryptogenic stroke and PFO. The right choice depends on individual factors, and working closely with healthcare professionals ensures the most personalized and effective prevention plan. Always consult your doctor to explore the best options for your specific situation.